Dr. Samira.
Hi.
How are you?
I'm good. How are you?
I'm fine. Thank you so much for your time today.
Okay.
So we just wanted to have a brief discussion about diabetes and hypertension.
Okay.
So why should we care about diabetes and hypertension?
Okay. So you should care about these diseases because they are chronic conditions that are slowly being left untreated. Patients do not take better care of their health, and with this, there's long-term health implications. There's deterioration of the quality of life, and may even lead to mortality, increased hospital admission. So patients need to take better care of their diabetes and hypertension.
Okay. So what are the causes of diabetes?
So diabetes has an array of causes, but for type 1 diabetes, it's an autoimmune illness that mostly occurs in children. But for type 2 diabetes, it is caused when your body starts getting resistant to insulin because of several factors predisposed to you. And the biggest one that patients need to watch out for is the genetic predisposition. So if there's family history of diabetes, then the patient needs to look out for diabetes as they grow older. And then other risk factors are the unhealthy lifestyle, lack of exercise, obesity, alcohol abuse, and using harmful use of tobacco, amongst other risk factors.
Okay.
Yeah.
And are those similar to hypertension, or hypertension also has its own causes?
Yes, it is similar to hypertension. So for hypertension, it's we call it the silent killer, and you never know when you're hypertensive, but there are some things that you might be looking out for, and these are the risk factors that might cause hypertension. We never know the cause for hypertension unless investigated by your physician, but for majority of the cases, it's unknown. The risk factors are, funny enough, if you're if you're a black person, you're at a higher risk of getting hypertension. Age is another factor. Of course, stress is another factor. Unhealthy lifestyle, lack of exercise, diet, and then of course the others, harmful use of alcohol and harmful use of tobacco also put you at risk of getting hypertension.
Okay. So are there any red flags that people should look out for when it comes to diabetes and hypertension?
Yeah. So for diabetes, the red flags, of course, are some of the risk factors that I mentioned. And when you start seeing things like you're excessively thirsty, if you're excessively hungry a majority of the time, you'll start thinking, is this diabetes? And then when you cut yourself, when you get a wound and you're not healing, majority of the time you're having what's it called, unexplained weight gain or weight loss sometimes. All these red flags for diabetes. And then for the red flags for hypertension, all these risk factors that I mentioned. If you're feeling like you're having unexplained weight gain, you're having high blood pressures every time you visit the physician, and they're constantly warning you to take better care of your lifestyle habits, then I think it's time to work on it. If you're having unexplained headaches, dizziness, you're constantly fatigued, you're constantly tired at work, then all these are red flags for hypertension as well.
Okay. But it sounds like there's so much more that we need to talk about.
Yeah.
Okay, so maybe we can have another session, yeah?
Yes, we should.
That sounds so good.
Perfect.
Thank you so much.
Alrighty.